our program going forward, we're going to focus on the knee. All right, so oftentimes there is, residual knee pain, or maybe you've already had a knee replacement surgery, you've had some physical therapy, and you've just started to feel a little bit more tension, some pain, or maybe you've just always had some sort of knee pain. All right, so what this program is going to get into is a number of different exercises that will help with strength, stability, and flexibility within that knee to eliminate the pain. All right, we're going to break it into 4 programs as we've done in the past with our lower back and our shoulder program. So we'll start here today with phase 1, and we're going to get into our first exercise. So I'm on the ground here. I'm sitting on a foam pad. You can sit on a pillow if you want. We're going to take a plate here. All right, so I've got just a paper plate along the floor. And what we're trying to do is we're trying to slide this plate in to increase the range of motion within our knee. Now, if you do have some sort of knee pain, especially once you get to a certain point, we're going to try and avoid going beyond that point of pain. All right? So if I get pain right here, I'm not going to force my knee into this position here if it's going to be causing me pain. All right? So what we're trying to do is we're trying to gradually increase that range of motion. So the first couple, you might notice that you have a limited range of motion. All right? You might only get to here. But as you go on, you might notice, okay, now my range of motion is starting to increase a little bit. I'm getting a little bit closer towards my butt. That's awesome. That's exactly what we're looking for. So what I recommend here is completing about 15 repetitions on the leg that's bothering you more. Now, it doesn't hurt anything to go over to the opposite leg and do the same thing as well. All right? This program isn't going to be too strenuous in the fact that you're not going to want to do it on the other leg. But if you do feel any sort of pain within the other leg, I do recommend going ahead and doing this exercise on both sides. As I mentioned, go ahead and do 15 repetitions, trying to increase the range of motion within each rep that you do. We'll still be on the ground for this next one. We're going to get into what's called a glute bridge. So with our glute bridge, we're going to set our feet up to about shoulder width. Our knees are going to have a bend in them. Of course, this is going to be a little bit restrained if you do have pain upon that bend. So I want you to get into a position where you don't feel pain within the knee. All right, so your knees might be a little bit more bent, a little bit less bent. They might be a little bit straighter. That's okay. We're going to go ahead and come down to our back. And from here, we're going to try and lift our hips up and off of the ground. All right, so we're going to press our core down. We're going to try and put our lower back down into the ground. And then we're going to lift our hips up like so. So for this exercise, you shouldn't feel any pain in the knee. What we're trying to do is we're trying to strengthen the whole posterior chain. So our glutes down into our hamstrings to help stabilize this knee. All right. I do recommend completing 2 sets here, anywhere from 10 to 12 repetitions. So it'll be the same thing for the second set. We're simply going to keep the lower back pressed down. We're going to lift the hips up, keep our knees from caving in. All right, so if you do notice that your knees are starting to come in as your hips go up, that's going to point towards some weakness. So really focus on driving the knees out. All right, the next one that we're going to get into is what's called quads over fulcrum, or basically a seated terminal knee extension. So I have access to a foam roller here, If you don't have access to a foam roller, you can simply grab a very dense pillow. You can kind of put a pillow underneath the knee here. But as what we're trying to do is we're trying to increase the extension of the knee by squeezing down on these quadriceps. So part of having healthy, stable muscles is understanding what muscles have to work in order for different things to happen and having control over that. So this is one of those exercises that really does help that, because what I'm going to do is I'm going to sit myself back. I'm actually just going to kind of let that knee sit right on top of the roller. And from there, I'm not trying to necessarily lift my foot. I'm going to focus on driving my knee down into this roller and squeezing this quadricep, this group of 4 large muscles, in order for that foot to raise up and off of the ground. Alright, so again, I'm not necessarily thinking about raising the foot, because when I think about raising the foot, tendency to lift that leg completely up and off of the ground is what normally happens. I'm thinking about pushing my knee down into the roller and squeezing the top side of my upper leg. From here, I would go ahead and complete 15 repetitions. Again, if it's just one knee that's bothering you, this is okay to complete on just the one, but it's never going to hurt you to go ahead and switch over to the other side as well and complete the same exercise here. You might notice a slight difference if you do end up doing both sides here. One knee might push down a little bit easier and that foot might raise just a little bit higher. Sometimes there's just a little bit of a difference between the extension of the knee. That's going to wrap up our first part, but go ahead and stay tuned for next week. We'll get into phase 2.